Let's bring you another story that's emerged today. New figures show that Essex police deal with one mental health related incident every hour. A Freedom of Information request showed that the force dealt with 9,000 incidents in 2016 alone. It means they're among the busiest forces in the country dealing with this sort of thing. The data was obtained by the think tank Parliament Street. Danny Bowman is their spokesperson and says he was surprised by the numbers.
My initial reaction to these figures was shock, really. I mean, the amount of time and the amount of incidents that include the police dealing with mental health crisis is incredible. And obviously in your areas, it's 9,002, I think. But in some areas, it's even been 38,000, which is incredible. I mean, it really is, and it really sort of exemplifies a bigger issue.
What bigger issue do you think that exemplifies? The need to try and stem this, I guess?
I think what it really exemplifies is, and the bigger issue is, that there's simply not enough investment going into mental health services, and especially community mental health services and crisis care. So what's ending up happening is that the police are left to deal with mental health crises instead of the people who can actually truly help someone with going through a mental health crisis get back up. So I think what we need to look at in this situation is what the big issues are, and to me that is the biggest issue.
So too many people are slipping through the net of the services that should be there to help them and end up in scenarios that require the police to deal with them.
Definitely. I think, there's too many people slipping through the net anyway. And if you were to look at the idea of, early intervention, there's not enough money actually going into mental health services. So it actually takes people to get to crisis point. And then when they do get to crisis point, there's not enough resources available to mental health services to cope with that. So it ends up that the police, end up dealing with it, which is not really right.
The problem is there's not enough money anywhere. We hear of cuts to the public sector all the time. I mean, is there going to be do you see a scenario where these sort of incidents can come down?
I do, actually. And, we talk about, the expenditure of it all. Mental health cost the economy in 2015 $105.2 billion. And inevitably, if we start investing now in mental health, we will save money. So talking about the idea of expenditure, inevitably, we've got to invest to save in mental health. Because as the figure I just quoted, which includes, lost work days, police time, but also people ending up in prison with mental health problems, people ending up on welfare with mental health problems, we really need to start funding our mental health services, and then I think it will reduce the level of police time, which is spent dealing with mental health crisis.
Yeah, we've got a statement from Essex Police, Danny. I'll just give it to you in two parts. Firstly, firstly they say many of the incidents involve no crime being committed, which does suggest, that why is it the police force that are dealing with them then? Because they're using, they're going to these incidents when actually they probably should be elsewhere if no crime's being committed.
Definitely, and I mean that yet again exemplifies the point that they really shouldn't be the people going to these incidents. These incidents are not for the police. There wasn't any crime committed, so the police shouldn't have been called. What should happen is there should be a mental health professional that should be there supporting them, helping them, and directing them to the right place. But this goes to a bigger argument about there's not enough beds. There's so many different angles, so many different sides to this. But you're completely right, and I think Essex police have pretty much hit the nail on the head that there was no crime committed, so why are the police dealing with it?
The fact that you point out there are so many facets to it, it is part of the problem, isn't it? You mentioned sort of health and prisons and police, and that is, because it's harder then for someone to take an overall responsibility.
Yes, but I think we should start investing in early intervention and invest in training more people to go into the field of mental health. Because if we do that, then people will get treated quicker, which means they're less likely to end up in prison. They're less likely to end up on welfare. They're more likely to be ready to go to work and ready to work. And I think if we can start investing in mental health, then we can start to see a bit of a change. And I think that's the step forward.
And Essex Police just finally add that they are increasingly concerned about the level of capacity in the health sector to deal with these issues. So it's not just your think tanks like yourself, but it's police forces as well. The hope is, I guess, that at some point someone will try and take responsibility for this and solve the problem, because you're getting lots of voices saying the same thing.
Definitely, and I must add, the police do a fantastic job, and they do the best they can, as well as mental health professionals. They do the best they can too. In my personal opinion, I think the buck stops with the government. They need to start investing money, and unless we start doing that, the mental health is going to cost more money to the economy. The police are going to continue to be frustrated by this, as well as mental health professionals, and we're not going to move forward.
That's Danny Bowman from the think tank Parliament Street discussing this freedom of information request that shows that Essex Police deal with one mental health related incident every hour for the whole of 2016. That, of course, on average. We asked Essex Police if they wanted to come onto the programme to contribute to this discussion. They sent us a statement saying many of those incidents involve no crime being committed, but as an emergency service, our job is to keep people safe and prevent harm to individuals or other people. We are increasingly concerned about the level of capacity in the health sector to deal with these issues. Chief officers and the Police and Crime Commissioner are in regular contact with senior health officials to reflect these concerns and work towards a solution. But in